I'm Chao from Beijing Anzhen Hospital.
I'm Zixu Zhao from Anzhen Hospital.
As we know, ablation has become the first-line therapy of the rhythm control in patients with atrial fibrillation. However, a large proportion of patients also suffered recurrence after the ablation. The SGLT2 inhibitor, a new agent that for the anti-diabetes drugs, have shown significant cardiovascular protection in patients with diabetes, heart failure, and chronic kidney disease. And some post-hoc analyses from the clinical trials have shown that SGLT2 inhibitors have a significant effect to reduce the AF recurrence after ablation. And also, our prospective China AF registry study shows that the SGLT2 inhibitor use was associated with a significant reduced recurrence after ablation in patients with atrial fibrillation. However, there are no randomized clinical trials to test whether SGLT2 inhibitor could reduce AF recurrence in patients without diabetes, heart failure, or chronic kidney disease. So we conducted the first AF randomized trial to test this assumption.
So we focus on patients with persistent AFib, but without current indication for SGLT2. Mostly patients without diabetes, heart failure, and CKD. So after recruiting, patients were divided into dapagliflozin group and control group to receive. So for patients in the 3 months, for patients in the intervention group, they will receive 3 months dapagliflozin for treatment. So the primary outcome of the study is AFib burden monitored by ECG patch for 7 days. So unfortunately, we didn't. There's no significant difference of AFib burden between two groups, and there seems no impact of the reduction of AFib recurrence in the dapagliflozin group. In the secondary outcome, we did not find that dapagliflozin reduced the size of left atrial, and there's no impact of dapagliflozin on the quality of life in patients in the intervention group compared to the control group.
I think the major limitation of our study is that the treatment of dapagliflozin is short, relatively short, only 3 months. So future randomized clinical trial are warranted to test about long-term treatment with the SGLT2 inhibitors. Maybe 1 year treatment of SGLT2 inhibitor could reduce the risk of atrial fibrillation recurrence after ablation. We should cast that question. And also, we know that the heart failure is the most common comorbidities and the leading cause of death in patients with atrial fibrillation. However, the heart failure, especially the heart failure with preserved ejection fraction, are often unrecognized in patients with atrial fibrillation. So future study is warranted to test whether SGLT2 inhibitors could reduce the risk of heart failure hospitalization or mortality in patients with atrial fibrillation.